Hey there, everyone. This is Dr. Rob. I am going to review comments and questions that were posted to the channel on Buspar today. Um, Again, a lot of common questions and comments that overlap, questions that we see routinely in the clinics, questions that I see routinely in the clinics, and that's from primary care. I'm a family physician. I work urgent care, and so I'm going to give you maybe a little bit different perspective than what my wife gives you. So yeah, today Buspar. But before we get to the first question that was brought up, um, remember everything that we say, everything that the videos show are really for your general medical education. Please take that information, build a good foundation for yourself of what is useful and how you can apply it to yourself, but then bring that to your prescriber or your provider to make sure that it's a good fit for you as an individual. So let's see here. We'll get to the first question. This is from Joe Bruno. I just took it for the first time today. I'm having worse anxiety. I'm very spaced out. My heart is going from fast to slow. I'm very high feeling. And then there was a couple of responses there. Bricktop said that made my anxiety worse as well. Then JDW was wondering if they're feeling better now. I'm experiencing this as well. Started to feel normal again. How long did it take, etc. So that's kind of a loaded question. Again, a lot of questions like that in the clinic and on the channel for a lot of different medications. So this back up to Joe's original question, having worse anxiety. The first thing I kind of wanted to go through is to show how I deal with potential side effects for medications, because I don't know every patient super personally, not being their primary care provider. We got to break down a lot of different medications, a lot of different potential side effects. So what I do with the patient in clinic is I go to this website. This is drugs.com. Drugs.com is a great resource with a lot of up-to-date information constantly being reviewed. You can see that this one was last updated on January 4th of this year. I type in the drug up here in the search bar, and then I just go to the side effects tab. Then we scroll on down. You can see right up front, or at least the first little section here, is generally supposed to be for anybody who's not a doctor, who's not a prescriber. And so they kind of just list out the either common ones or rare ones, or the ones that you really want to talk about or be aware of up front. So they list a lot of rare side effects here. Scroll down a little bit further about side effects that would need medical attention or special consideration. And they got those broken down into more common or less common side effects. I like to go down here to the healthcare for the healthcare professionals. It is, I just think it's more useful because it gives you a percentage of what is the likelihood that something like this is going to happen to you. And right up front here, nervous system. Very common: dizziness, drowsiness. That's kind of what we're looking for when we're prescribing Buspar, right? We're trying to calm down anxiety. That's what it's usually prescribed for. So drowsiness and dizziness is definitely a very common side effect. But the question was about not about drowsiness, but my anxiety is getting worse. So let's search anxiety. And that one does not come up. No effects on the hepatic, metabolic, endocrine, or very, very, very few side effects when it comes to that. Psychiatric: insomnia, nervousness, excitement, all right here. It can worsen depression. It can give you vivid dreams, and just general sleep disorder, not otherwise specified. That is common. It's 1% to 10%. So that nervousness, excitement, and driving people to feel worse and not necessarily better, feeling more anxiety, not less anxiety. That is definitely on there as a common side effect. In the uncommon list, 0.1% to 1%. So you're talking about somewhere between 1 in 100 patients that take this medicine and 1 in 1,000 patients that take this medicine. You can get that feeling like you're not yourself. You can get a dysphoric state, just feeling kind of loopy. You can feel euphoria. You can feel a loss of interest. You can, in some cases, have hallucinations. And then there's involuntary movements. Relatively uncommon, but they do happen. So let's go back to this question here and highlight this point again. I'm feeling worse. There's multiple people that have felt this. Why is that? And I was kind of excited about this because this is something new that I learned in the mechanism of action for Buspar. Why would you feel the opposite effect than what you are intending? So I took this slide from Washington State University, and I thought it was probably one of the better ones as far as showing you a good diagram of what we're trying to treat, what we're trying to change to help us cool off our anxiety and feel a little more relieved. The top box there is the state of anxiety. There's too much serotonin in between the two nerves. This is the first nerve, the presynapse, and it's communicating with this nerve over here, and it's pumping out way too much serotonin in between that space, and that is driving a lot of people's anxieties. So Buspar comes in. You can see these little black dots here. They are attaching to the presynapse. So the serotonin in these bubbles can't escape out into the synapse, and then they can't reach and communicate with the postsynaptic neuron. So what happens there? Well, our anxiety goes down. That's what's supposed to happen. But my wife just kind of mentioned it because she's much smarter than me. These little black dots that are representing the Buspar, sometimes they have a partial affinity for these receptors on this side. So instead of blocking the serotonin from getting released into the space, sometimes they are acting as if they might be serotonin and attaching to this side. And that's how, at least that's theorized, how that is why a lot of people can have a worsening of their anxiety. Or at least that's one mechanism why that might be happening. So that was, I really enjoyed learning about that. But a super common question, a super common concern from a lot of patients that I'm feeling more anxiety, not less. And that might be how. Next question here, Celestial Trailblazer. The $1 million question, does this medication cause your heart rate to drop at a dangerously low level? So that's bradycardia. Is it getting dangerously low? I'm very careful about taking my anti-anxiety medications since a lot of them cause significant drop in resting heart rate, which increases the risk of sudden cardiac or stroke. This person in general might be super sensitive to the fluctuations in their neurotransmitters, which doesn't just affect how we think or just our mood, but that produces effects on the body as well. And some of those effects, and particularly when you're talking about acetylcholine, and some of these medicines have small impacts on acetylcholine, they can affect heart and heart rate. So back to our drugs.com real quick. Pop it up on the big screen here. If we put in here and search for bradycardia, down here under cardiovascular, it's considered, let's go this way, it's considered rare, less than 0.1%. That also includes congestive heart failure, myocardial infarction, heart attack, cardiomyopathy, which is a dilated heart, and then here bradycardia. So you're talking about 0.1% is 1 in 1,000. It's going to be less than that. Maybe it's 1 in a couple thousand, or 1 in 5,000, or 1 in 10,000. It's going to be pretty uncommon to see that. But this is a good point to be had, though, that just because it's uncommon or just because it's rare does not mean that it can't affect you, because it might be rare, but to you, it's everything if you're feeling that. To the second part of the question there, is it getting dangerously low? That's a little bit more, I'd need a little more information on that. I have not come across anybody that had any significant bradycardia with Buspar. A few other medicines that we have, but even when I put people on beta blockers, which are intended to slow down the heart rate, you have to be a little egregious to get the heart rate down that low. Or you might have like doubled your dose or something like that. So to get a heart rate down to bradycardia, which is less than 60 beats per minute, and then have it be very significant to the point where you are going to cause yourself significant harm, is unlikely. So you're already somebody that's in the rare category of low heart rate, but you have to be down into the 30s and 40s if you're not a marathon runner to be really super concerned about starting to induce ischemia, meaning or just not getting enough blood flow to the organs that need them. That includes your kidneys. That includes pumping enough blood up into your retinas. Something that's going to happen probably even way before that is the other side effects, which are lightheadedness, dizziness, feeling like you're going to pass out, way before you get to the point of significant slow heart rate to the point of causing significant heart damage. But it is on there. It is labeled. Cardiomyopathy, heart attacks can happen. They're just very, very uncommon, very rare. And yeah, I forgot to mention, if anybody's watching live and you have any questions about Buspar, put them into the chat, and I'll see if I can answer them. I'm going to jump over to Ty, TY here. Just saying that every person has said completely different things about this silly medication. Gotta cater to everyone. Shake my head. I see these types of comments frequently, and I feel like it really comes from a point of frustration. Because it is confusing when you're prescribed a medication for a certain outcome. We want to have less anxiety. That's why we're prescribing Buspar. But then you get all these comments saying, I did not have a good time with it. I had more anxiety. I had terrible sleep. I had insomnia, whatever the case. And then you hear other people that get really good outcomes, like another comment here that we're going to show in a second. That gets really confusing and frustrating, and it gets people nervous. And I'm hoping that by talking through some of these side effects, talking through some of the problems that we do routinely see, that helps mitigate any undue fears, but also at the same time realizing that these medicines are potent and they are prescribed for a reason. They can have some serious effects on the body, and that kind of goes along the lines of pharmacology being a controlled toxicology. We want to be careful with that, with those medications. Small doses, the right doses, we get a good benefit. But we get outside of certain ranges, and all of a sudden we're talking about just bad side effect. We're talking about the toxicology part of medications causing not so good effects. Let your light shine. Question is, can I take Buspar with lorazepam as needed? Kind of a short answer, yes. you can if it's prescribed that way. Generally, Buspar is prescribed for the intention of being taken consistently, almost always twice a day. But for the intents and purposes of being taken twice a day to get a good steady state of that medicine inside the bloodstream. There are a few prescribers that will use it, prescribe PRN. It's generally not um, it's not labeled for that, but it's more of like an off-label usage, PRN. Um, and you can find people that have definitely get that hit, that kick, that effect of bringing down their anxiety, getting those racing thoughts to push the brake pedal a little bit, and take it as needed. Can you take both of them together? Yeah, yeah. People are on Buspar and lorazepam, dual therapy. Lorazepam or Ativan is benzodiazepine medicine. Different mechanism of action. Almost always, you'll never see prescribers prescribe any two medications that are in the same class. So you won't see people prescribe two SSRI medications. You won't see people prescribe two benzodiazepine medicines. God willing, hopefully not. You won't see people prescribed two beta blockers or two calcium channel blockers if we're dealing with blood pressures. We want to do a couple different mechanisms if we're going to start layering medications in general. So can you take Buspar and lorazepam as needed? Yes, you can. It is kind of, it would be odd for a prescriber to label them both as needed. But you could do that without too much risk of medication overlap and polypharmacy, and then getting too many potential side effects going on. This is a Ray's journey. Is it just me, or do all psych medications clear my sinus congestion? Sometimes I wonder if my sinuses is what's causing my symptoms. I always feel better when my sinuses are clear. I had to put this one up here because I've already looked through drugs.com on that one. I don't know if that being a side effect that was intended. Maybe not even a side effect that the people making the studies were even looking for. I've never heard that. Certainly not all medicines are going to do that. Maybe you are unique in that case where your sinuses do feel better when you're on your sinus medication, but I'm willing to bet there's probably a different mechanism that's causing your sinuses to get relieved, whether it's timing of the year, allergies, maybe just kicked a cat or a dog out of your house. I don't know, but that one's definitely unique. I've never come across that. I've never heard of that, and it's not on drugs.com. But maybe it is there's always that room for potentially maybe. Just Casper. It works. It meaning Buspar, I assume there. Doctor changed my Xanax to Buspar, and honestly, I hated it at first because I have severe anxiety and was used to the Xanax for 25 years, but it took a week for it to work on me. I'm on 15 milligrams a day. I still don't seem like it's enough, but my brain was just used to the Xanax. That's 100% true. If you are somebody who's on Xanax, who's become used to Xanax, and and your provider is trying to pull you away from Xanax because of the risks, long-term effects from the Xanax, the risk of coming off of the Xanax, particularly with seizures. Yeah, Buspar is a good medicine to attempt that with, because you get that you get a relief factor from Buspar relatively quickly. But I'm not going to sit here and tell you that it's easy either. This person clearly makes it known that Buspar is working. It is effective, but it's not giving that punch necessarily like Xanax is. And again, Xanax, that's another benzodiazepine, kind of like the lorazepam or the Ativan. Could take them together. But in this case, for the intent of pulling off of one medicine and onto another, that's generally a little bit safer. Xanax has a very short half-life, so you get a bunch of spikes in the dose in your bloodstream, and it kicks really pretty hard. So there's a lot other benzodiazepines that don't kick nearly as hard, but give you a good effect by tagging onto the GABA receptor inside of our brains on the nerves. Um, but it is a chore. And if you are on Xanax looking to switch off, I encourage you to go to my wife's um, video on Xanax, because she does go through that in pretty decent detail, particularly about coming off of the medication, um, being cognizant of the risks of coming off of the medication, particularly if you've been on a long time and higher doses. You gotta drop low and slow, but it also can has the very real possibility of switching over to something like Buspar, of lowering your pill burden, which nobody likes. Nobody likes walking around with, 50, 60, 70 pills in their pocket, or in their medicine cabinet, or anything like that. So it can be very, very useful. Then we got this last question up here. Blow that up. Carlos Reyes says, my doctor prescribed this medication to me 2 weeks ago. I have yet to take it. I'm nervous about it. Um, but does it make you drowsy like meclizine or Xanax? I suffer a lot from anxiety, motion sickness when I'm traveling, etc. Um, XOXO says, same here. I was prescribed Zoloft and combined with the Buspar about a month ago, but I'm too scared to start taking them. And then this was Carlos a few months later saying, don't take it, way too many side effects. I stopped taking it a while back. I suffered from insomnia. And that I'm highlighting that point because you kind of see it live there, where people have legitimate concerns about medications, side effects or symptoms pop up from the medication. And to answer Carlos's original question, does it make you drowsy like meclizine or Xanax? Yes, absolutely it is. Back to the original drugs.com screen, way up at the top. Common side effects: dizziness, drowsiness, even fairly common 1 to 10% lightheadedness, and then headache, syncope. I am trying to find probably down in the psych area. Yeah, okay, yeah, back common 1 to 10% insomnia and sleep disorder. So yeah, those definitely happen. Pop this back up, this question back up. But yeah, those side effects definitely happen. So going through that side effect profile, understanding them before you start that medication is important. Also keep in mind that there are two different types of what can you expect from side effects. Are they going to go away? Are they going to stay present? There's two different things that we talk about. One is a time dependent side effect. The other is a dose dependent side effect. And the time dependent side effect is where when we start a medication, there's new levels of neurotransmitters that our body isn't used to, and it takes time to get used to that new set of balance of neurotransmitters. And so as time goes on, generally those side effects will decrease and go away. The other side effect profile is the dose dependent. The dose dependent, the higher the dosage goes, generally the more side effects you get. And that one makes sense, right? I mean, if we have a itty bitty little dose where it might not even be having a substantial effect on the body, to the point where we're not even seeing the good side effect that we want to have, nothing, you're probably not going to have a bad side effect either. But as the dose goes up, we get the better benefit of what we're trying to get out of the medication. So does the potential for those side effects to leak through and to show their face. Um, so my question, or at least when I'm talking to patients, I'm sitting here wondering, like Mr. Reyes or any patient in front of me, how long have you been on the medication? If you've been on the medication for a fairly healthy amount of time, 4 to 8 weeks, and the symptoms are constantly coming. Every time I take the medicine, I get this X, Y, or Z side effect. Then the answer is, well, if it's been that long, you haven't had any change in the dose of the medicine, then yeah, it might be the medicine is going to constantly be there when you take that medicine. But if you've seen a decrease in the severity of those side effects after a handful of weeks, there's still a good chance that those side effects are still going to continue to eke out, level off, and dissipate completely. And I would say hold on a little bit longer if you could. But it's also about tolerability. If the side effect is just not tolerable, then that might not be the medication for you. Or another strategy that a lot of prescribers use is to take the medicine. Okay, maybe we're getting a little bit of a good effect from the medicine, so we don't want to totally abandon it. But at the same time, the side effects aren't so good. Maybe let's cut down the dose a little bit, cut it in half, or depending on the type of pill that you have, cut it down to a point where maybe we eliminate those bad side effects, but still get the good benefit that we're looking for. Yeah. And that's all those are the common questions that again we see timed routinely in the clinic. And I just want to bring these comments and questions up front and kind of answer them for everybody in the way that I perceive it, and the way that I go about counseling a lot of patients in the clinic, in express care, in an urgent care, because at the end of the day, I don't want to change their medicines. I don't want to be messing with their medication regimens that they are establishing with their provider, and their provider might have their own goal that they're trying to achieve with the medication. But I understand that sometimes you're feeling side effects. You're feeling the exact opposite of what you thought you would be feeling, and it's hard to get back into your prescriber. Um, so this is the type of approach I take with the patient when they're in front of me, that with the goal of not changing any medication. But when certain severity of side effects get to that point, changes need to be made. So hopefully this helps anybody watching. It gives you a good base or foundation to bring some of these concerns back to your own prescriber or provider, and make a good informed decision-making process with your provider. If anybody has, I had two of them that I was going to talk about next week, next Tuesday at noon. It was either going to be Xanax or Prozac. So put them in the comments. If you want to see Prozac, put down Prozac. If you want to see Xanax, put down Xanax. And then we're going to do the same thing, reviewing those comments and questions next week. So thank you, everybody. Have a good day.